providers in rural communities. All right. So the presentation today will focus really on technology and surrounding providers in rural communities and how that they can work together to really provide more support, increase access, and ultimately improve outcomes in rural communities. That's really the focus for today. So myself, Eric Sullivan, I'm the CEO, co-founder of Unio Health, based out of Anne Arundel County. We've been working with the school systems and clinics across the Mid-Atlantic for a few years. Tiffany, you introduce yourself real quick?
Sure. I'm Tiffany McFarland. I'm the mental health coordinator for Calvert County Public Schools. I've been in my position, I believe this is my fourth year. Yeah, this is my fourth year in the position, and started working with Eric last school year um, during the Maryland Consortium.
Great. Thanks, Tiffany.
Mhm.
So to kick things off, just in terms of framing the different challenges in rural health and I'll kind of focus really on Maryland. There's been fortunately and frankly fortunate to the work of Jonathan, you and your group at the Maryland Rural Health Association, a lot more focus on rural health. And we see this even with the federal grant that's coming out for rural health technology investments, measured in the billions over the next 5 years. There is a growing awareness that all things are not equal across rural, urban, suburban areas, and particularly in Maryland, about 18 to 20% of Marylanders are in rural communities. And you think of the western counties and the St. Mary's, Charles, Calvert counties and Eastern Shore. There is definitely issues around access and availability. 2/3 of the nation's primary care shortage areas are in rural communities. There's about three times less providers per capita, primary care, think of mental health providers, et cetera, in rural communities than there are in urban and suburban areas. So from an access and availability and related workforce shortages, it creates a lot of challenges for folks that are dealing with chronic conditions, just basic prevention and wellness as well. Certainly we'll focus more on today around mental wellness and support for that. From a disparities perspective, there definitely are more challenges in rural communities, certainly often higher unemployment, uh, not to mention just access and the other areas. Chronic conditions, the outcomes often are for those that live in very remote or rural areas versus if you live, say, in downtown Baltimore, where you're close to Hopkins or Maryland, et cetera. So there definitely is disparities in the access and just number of different issues surrounding rural communities and technology and infrastructure, which we'll hit on today. Whereas most counties in Maryland, about 95% or higher, people have access to broadband and data. There are several counties that have 75, 80, 85% access, which means that there are, hundreds of thousands, certainly tens, if not hundreds of thousands of folks that have more limited access. And that's where you see folks accessing um, support, whether it's telehealth or just looking up providers or going to the libraries or going to other central locations. And I was at a conference, or sorry, a community session in Brunswick, Maryland, a few weeks ago, and the distance that people are traveling just to access technology, actually access providers, is very challenging. In certain pockets, even accessing through your smartphone can be limited. It's getting better for sure with recent investments, but there's still challenges. And then financial constraints, as I mentioned, unemployment is higher. Just the cost to transport yourself an hour to go to see a primary care provider, things like that can really weigh in on and ultimately impact outcomes for rural health communities. So with that, I want to hand it off to Tiffany to talk about what Calvert County is doing, kind of just lay the landscape there, and then we'll walk through what we're focusing on today, which is around youth and family prevention and mental health support. So Tiffany, hand it off to you.
Thank you, Eric. So I just wanted to give a little bit of an overview of Calvert County Public Schools. We are a pretty small county. From the south end to the north end, it takes about 35 minutes of travel time, and that's with all of the traffic lights in between that you might get stopped at. So small county, we have 12 elementary schools. Of our elementary schools has a behavior development program in it, and one has an alternative education program in it. We have 6 middle schools. Of those 6, 2 have a BDP program and 2 have an alternative education program. We have 4 high schools. The 4 high schools all have their own alternative education program, and then one of the high schools has a behavior development program. And with the behavior development programs in any of the schools, we can send students that need that program from a different school to that school. We have a career and technology academy that 11th and 12th graders can access if they want to be in like cosmetology, culinary arts, mechanics, things like that. We have a county alternative educational school that um, if a high school or a middle school student needs extra support that their middle school or high school cannot um, support at that time, then they will go to our county alternative education school. And then we have a public separate day school that can house students from kindergarten to 12 and then up to 21 years of age if they're a transitional age youth. And in that day school, they teach functional skills, learning for independence. They have a behavior developmental program as well, and a structured learning environment for those students. So, as you can see, small county. Um, Within our schools, we have behavioral health providers. So we have 16 school social workers. 7 of our school social workers have more than one school, and one of our school social workers is only part time. So she, I think, works 2 days a week at one school. We have 12 school psychologists, which is low, and we're definitely trying to get more school psychologists. However, with the workforce shortages that we're seeing, it's kind of hard to retain them. All of our school psychologists have more than one school. Most of them are at 3 or 4 schools, and 3 of them are part time. All of our schools have at least 1 to 5 school counselors. It really depends on the need of the school. Our elementary schools usually have 1 to 2 school counselors in them. Middle schools have 2 to 3 school counselors, and then our high schools have anywhere from 4 to 5 school counselors. These are some of the programs that we implement within our school system for social emotional learning. So these programs are either done by teachers or our mental health staff within the school system. So we have restorative practices. All of our staff will be trained in restorative practices by 2026. So we have trainers that come out. We have our school trainers that are also teaching restorative practices in our schools. We do life space crisis intervention. Right now, we only have one senior trainer that works with staff. To do that, all of our mental health staff are trained in life space crisis intervention. And if they're not, they are getting the training. And then we also open it up to administration and teachers that would like that training. All of our schools do PBIS. It's our positive behavioral interventions and supports. Most of our schools create their own program. In the elementary schools, usually they can earn some type of like rewards. Like I know that we have like Paul Bucks in some of the schools and things like that, where if the students earn a certain amount of rewards in PBIS, then they get to like pick a certain treasure from like the treasure chest that the teacher does and things like that. Renew is only at the high school level. It's a career readiness program that some of the school counselors do. Mental health staff, some of our school social workers are trained in it. I am also trained in it. And it is really helpful working in career readiness with trauma informed practices also. We have a therapy dog program where 2 of our school social workers have trained therapy dogs that go throughout the school, different schools, and help support social emotional learning. And then our Teach Autism program, our instructional assistants and our mental health staff and some of our administration were trained in that last school year, where they actually came and taught us how to better work with children that have autism.
And Tiffany, given the focus from rural health and communities, can you just hit on, for those who may not be familiar with social emotional learning, how you see that's with the role that plays in terms of focusing on that in rural communities?
Sure. So, in rural communities, with these programs that we have implemented, it helps us within the school system. So, we don't have to necessarily, try and outsource those certain practices. It's hard to find some of the people that are trained in this. In these like restorative practices, we have I think one agency that is really actually like that has restorative practice trainers in Calvert County. Therefore, it's better for us as a school system to have our own staff trained, because it's really hard for us to outsource these certain programs when working with students in our school system that might need more support in social emotional learning.
Got it. Thanks.
So I know Eric already touched on some of the barriers that we're facing, but in a rural area, transportation in Calvert County is a huge barrier. We are, a small county and it only takes like 35 minutes to drive through. However, like we don't really have cities that are walkable in it. Like we have some community centers that if you live in that community, like yeah, you can walk to it, but really like we're pretty isolated, and getting to resources and things like that usually can't happen unless you have some sort of transportation. And especially with the economic crisis that everybody is in right now, transportation is a huge barrier. We had a lot of budget cuts in our school system, especially from this past school year to this most current school year. Everything was cut. Like um, we usually do a like huge mental health month where we're giving every single school $1,000 to work with all students in the month of May. We don't have that this school year because it was completely cut from our budget, which is awful because the students usually really enjoy the lessons that they get as well as like all of the prizes that they get during that month. Financial issues are a huge barrier in Calvert County. A lot of people are, looking for clinicians for therapy and things like that, but cannot pay out of pocket. And a lot of clinicians have gone to out of pocket, or they don't have, insurance to really cover the clinician that they want to see, which if their child is seeing a clinician that isn't necessarily helpful or beneficial, then that's not really going to be a good fit anyways, but their insurance might not cover a clinician that would be a good fit. Wages, especially with the furlough that is currently going on, has been a huge issue as well for people paying out of pocket. It's it's been hard. I actually work for a private practice that only does out of pocket, and a lot of my clients are like, hey, after like I can't come back until after the furlough. So it's been really hard on people to find access that will work with them. We also just have limited access to specialists and clinicians in Calvert County. A lot of students are on wait lists. Whenever I talk to their parents, they're like, oh, well, we need to go to Kennedy Krieger or Children's for our, we feel like our son or daughter is, struggling with autism, and but we have to wait for that diagnosis, and it can be a year wait for a specialist like that. Um, and then even therapists, because we're at such a shortage, there's wait lists for months out and things like that. So I hear a lot of parents saying like we're trying to get help, but we can't because of these wait lists that we're facing. There's also limited knowledge of resources that are available. I sit in our local care team meetings, and a lot of parents don't know that we do have certain resources available. So, whenever I'm in those meetings and all of those resources are being talked about, the parents are like, oh, wow, I didn't even know that this was a thing. And then we're a small county. Stigma and privacy concerns are huge here. I've, had clients that they're like, "Hey, my cousin and or, you've worked with this person, you're not going to tell them like what I'm talking about, right?" And I mean, obviously we all have to stay confidential and we're not allowed to say things like that, but it's still a huge concern to them that, I'm going to tell somebody something and then all of a sudden everybody is going to know about it. So the consortium, it started last school year, so 24 to 25 school year. We are working with a lot of the same partners this school year as well. And although there's been some growing pains that Eric can probably attest to as well, it is a great support. Within our school system, we have found, self-care and prevention at tier 1. The school system used to work very reactive. Like something would happen and then we would react. And within the consortium, we have definitely found ways to prevent that as well, which has been great. Um, this year, we will be at some point doing telehealth therapy through the school system. Hazel Health is one of our partners, so they will be providing telehealth therapy, which is great. However, it has not been started yet just because there's a lot of things that we'll get into in a little bit that the consortium partners definitely have to go through within the school system. The consortium has provided some clinics for us. We already had our mobile crisis unit, which is great. They go out sometimes and they do screenings and whatnot. And that's not through the consortium. That's just something we have in Calvert County, and they're great. But through the consortium, a lot of the providers have been able to come into the schools and give education about certain things. I know our health department, gives education about vaping and how that affects mental health and things like that. So that's been great. And we've also been able to access therapy services through our health department with the consortium. They were already in our schools, but now the consortium actually, pays for them to be in the schools, which is great. We also have our care management and coordination through the consortium. And we work very, very closely with our local behavioral health authority, who is actually going to be our hub starting next year for the consortium. So that will be great. And that's where they will basically house like all of the data with our consortium partners. And then just community education. We have one of our consortium partners does a summer camp. Some of them provide after school activities, which has been great, and just other nonprofits. And it's definitely helped. Again, there's been some growing pains, but it's definitely helped the school system with our multi-tiered support system. And we are still building on that within our school system. So it's been great. However, I think in a couple of slides we'll be talking about some of the growing pains that have also been there.
All right. Thanks, Tiffany.
Mhm.
So I'll just hit a little bit on the particular use case and rollout that our company did with Calvert County Public Schools and through the state consortium. Really focused on different ways of leveraging smartphone-based technology, meaning apps, right, to work with teens and their parents. Frankly, we were both in Prince George's County, obviously a very not a rural county, and in Calvert County, but leveraging that same app, which is called Prosper, to try to help folks and mainly teens focus on those core skills around social emotional learning, but the goal of it, knowing that there are some gaps in broadband, not so much in Southern Maryland. There are some in if you go all the way down to the very end of the state. But leveraging those technologies, can we, and as Tiffany mentioned, telehealth with Hazel, there's, can digital platforms really extend the work of and create more access to support, self-care support, peer support, telehealth in the case of Hazel and other platforms. Is does that, what does that work, and what is the impact of that? And we'll talk about the data a little bit as well. We know there's a large effort across the state to measure the impact of the consortium's investment in youth mental health. Focusing on engagement around prevention, assessing that, people in a way that's, as Tiffany mentioned, private, right? There is a stigma, regardless of community, but certainly rural communities where everybody feels like they know everybody else, that privacy is important. So can we both lean in on prevention, but also then collect information that can help ascertain where people are and hopefully redirect them into support if they need it. And one of the things that Tiffany mentioned, which I've seen this a lot as I've done a kind of a statewide tour, meeting with different communities, is there are community services out there. There are services through the health department. There are services through the school systems, a number of other nonprofits and in quasi-government agencies. But often you find that folks don't know about it. And despite all the great efforts of communicating it through newsletters and Facebook and everywhere else, there's still is a gap. And I think that gap is even more pronounced in rural communities than in urban communities, perhaps. But at least that's been my impression. It seems like the amount of resources that are available are there, not enough, because we know all the shortages as discussed, but just helping folks understand, both students and their families, what is available, and help connect those dots. And then just also, we know there is a big shortage in primary care. I know Chrissy's here from Maryland Academy of Pediatrics, and from a primary care perspective, but also just in behavioral health support, as Tiffany mentioned, there can be a 5 month, multi-month wait period. So can we really get folks, focusing on themselves, prevention, access to other services and support, where maybe they don't need behavioral health right away, but certainly when they are working with behavioral health provider, can this help extend those efforts? So it's really, not to replace anything, but in fact just to extend the work that's already being done. So sure, okay. So the consortium, as Tiffany mentioned, it's a statewide effort across all the counties. Our team, working with National Alliance of Mental Illness, AMG, Bowie State University last year, we rolled out this app called Prosper, which is on both app stores. Not surprising, since we're focusing on teenagers in high school, most of the access to Prosper was through Apple, as opposed to Android. It seems to be the 95% of the time it's through Apple App Store. But our focus was around tier one, so prevention, really helping people work on their own self-care, their own wellness, building those skills around coping and resiliency, just reflecting on where you are, and then when they need help, making them aware of what's available out there. So our goal this year is, last year I think we were in primarily about 10 high schools, 4 in Calvert County, all 4 in Calvert County, and about 6 or 7 in Prince George's. And this year we're going to be in all 4 Calvert. We already are to a great extent, and then probably 12 in Prince George's County, if not more. But really trying to get as many teenagers aware of Prosper as a self-care support app. And it's free, and it's in both English and Spanish online. So just jumping to some of the numbers, I am a bit of a numbers data person, but our mandate by the state was to just focus on an all student aspect, right? So MTSS tier one, focus on prevention, social emotional learning, some leveraging some evidence-based type tools like journaling and guided journaling and mood tracking and healthy habit setting, breathing exercises, but really just get students aware that self-care is a good place to start, right? You can't help yourself or others unless you're really focusing on yourself. What we found last year was that about 86% of the students, the teenagers, these were all teenagers in high school, found that by working on themselves through self-care approaches and just being aware of where they are um, from a wellness perspective, that their mental health was maintained or improved. And they found that this type of platform, it's Prosper is one of many apps that are out there. We just our focus really is around school systems and community support, but make those features easy to use. What we found out though is we had, and this is for Calvert County had almost 700 teenagers last year. We've already added about 300, I think, so far this school year already. But those 686 teens went into the app 7,700 times to just reflect on how they feel, track their emotions. We found evening guided journals was a huge thing for teenagers. Not surprising, they use their apps later in the evening. And a lot of times, and this is true in Calvert and other counties, is you really can't use your cell phones beyond high school, and even in high school, it's only often during lunch or other approved times. So, but we also know that teenagers spend about 77 awake hours outside of high school. So this is something that they can leverage at nighttime and on the weekends, et cetera. Guided journals was big, and what also was important for us is our entire team is all Gen Zers, Gen Z folks, except for myself, but that making sure that the design is simple enough and engaging enough to keep coming back. We found that almost 2/3 were come back many times, and I think Calvert High School we've got multiple teams that have used Prosper 200 or 300 times since the spring, which is fantastic. But really focusing on the social emotional learning aspects. So when you think about social emotional learning, and Tiffany really did a great job walking through all the resources in the community or in the school system, self-awareness and self-management are kind of core pillars to that, right? It's like when you're in an airplane, they say, put your own breathing mask on first before you help others. You have to be able to help yourself before you can really even effectively engage in communities. So being self-aware, doing that daily check-in, journaling, things like that, but then also managing yourself as best you can, right? So working on healthy habits, breathing exercises is important. One of the things that we did a lot of, and I know this is really, I think it's been helpful, and I think it's something that we're seeing a lot of the other consortium providers do, is we're promoting the other providers in the community, right? So if you're in Prosper and you're searching for mental health providers or behavioral health or addiction, you'll see in Calvert, you'll see Pathways, you'll see other providers that are there as resources to access. And we're seeing the other providers we're working with in Calvert County are doing the same. They're promoting that Prosper is out there as a resource, or that Hazel. And so I think in rural communities, there are resources. People don't know about them as much. So if we can all work together to promote what's out there and create this kind of a web of support, I think that's really can really get us to a 1 + 1 = 3 effect with all the partners working together with the school system and the local behavioral health authority.
And
So
Eric, I was
yeah,
going to add, like
yeah,
on that local care team that we sit on, that Prosper is one of the things that we mention to every single parent. And we even tell them, like, you can use it too, because a lot of the parents that are coming to our, local care team, they are, stressed out. Like they need
yeah.
help with, their student and things like that. So we always tell them, like, hey, like this is a free app that your student can use to just like check in with themselves, but you can also use it to help yourself as well.
That's a great point. We ended up having 3,000 teenagers in the springs use Prosper to work on their self-care and self-management. We had another 1,000 parents do the same thing. You also, I mean, obviously in some of the communities, there's a higher percentage of Hispanic community, or Spanish language folks. So we have a Spanish language version, which in certain communities is really important. There's not as many resources out there available for Spanish language residents. So having this available in both has been helpful, but we're still working on expanding that. The other part of this is just because there's a lot of great resources in the school, but my own spouse is been a school counselor for almost 20 years. It's the check-in, right, with the students is one of the biggest things to do. They pop their head out and look down the hallway and they're asking kids, how are you doing? Just getting kids to engage and find out where those needs may be. It's really hard to do that when you have five or 600 students as part of your roster as a school counselor, right? Or, several hundred. So this just helps extend that work. And when school counselors are talking about journaling or tracking your habits or emotions, um, this is a digital, secure alternative to that. We are an anonymous app, so we're not collecting name and address. Privacy is paramount, but so is safety, right? So the second we see that in the app that there's folks that are struggling, we're immediately prompting 988 and other resources in the community. But just to have a digital alternative that students can reflect on. So when they're seeing their counselor, the counselor can say, "Hey, how were you last week?" It may be less of a head shrug or shoulder shrug and be more of, "Oh yeah, I can see how I was struggling last week." This is, I mean, from a rural community's perspective, where access and getting into counselors can really be challenging. This can be a good way to kind of fill some of those gaps and provide some additional expanding of that type of resource.
And Eric,
Um,
I would love to
yeah,
add too
yeah,
that a lot of the students that are in therapy already, like they see their therapist, once a week or once every other week. Like most
right.
of them are not going, as much as they would like due
Yep.
to, the other barriers and whatnot. So this app as an in between can be very, very helpful too when they are checking in with their therapist as well.
Right, right. Yeah. I mean, I think it's everyone working together to create as much support, which has been, I think, really important in Calvert and other rural communities. And just to some of the things that the different resources that Tiffany was talking about, the nonprofits, the care management, all these other resources. I think that it comes down to it to support and get the word out about prevention, get the word out about working on yourself and self-care. It is a in the trenches type effort. You can't do it through social media in an effective way. You can't do it with flyers. We were at almost 300 events, and mostly in the spring, between Prince George's and Calvert counties. Just being at every community event, we would see the same providers, right? We'd see Pathways, you see all these other ones that are doing great work, and building these relationships between the providers so we can all reflect on it, kind of refer to each other and create this web of support. But there was nothing more impactful for us to get teens aware of this free tool and to work to help themselves than lunches. Like I've never spent more time in school lunches talking to teens about, what does self-care mean to you? What does wellness mean to you? What do you do to relax? So it's such an important opportunity to engage teens and let them know that they're not alone. There are resources that can help them along the way. The bottom picture of the group of teens there in the black t-shirts, that was at Northern High School in May, and we'll be doing a similar event, and I think in all four schools in May, April, May, tied to Mental Health Awareness Month. So, I think just getting kids to, kind of knock down the stigma that mental health is, taboo, but in fact, it's something we should all be focusing on. Fortunately, we're seeing more and more of that, even on social media, and that sports events are talking more openly about it, which is great. So Tiffany, if I can hand it off to you, just talk about kind of how the rollout's gone. You kind of
Yeah.
alluded a little bit to it.
This
So
is good. Yes, this is going to be the growing pains part that I kind of mentioned. So again, the consortium especially started last school year, and it was the first year that they ever did anything like this. Myself, my supervisor, my director, we were all like, we have zero idea what we are doing. This year, it hasn't been as smooth as I wanted it to be, because the school system actually started a different process. So last year, getting the buy-in from school staff was hard. Like some of the school staff were like, "Oh, well, we already do so much. Like, what? How are we supposed to also be engaging, with these other providers that are coming in?" However, once we settled into it, once we had some meetings with the school staff and whatnot, they were more so open to, helping as much as they could. Um, our system processes with the MOUs have been a struggle this year, especially just because the school system had started a new process. It has been they need to vet everybody that is coming into the school system, which I 100% understand. However, last year we needed like our superintendent's signature basically. And this year our superintendent that was here went to a different state. So now we have an interim superintendent, which he has been great. However, the signature process of the MOUs was, and it had nothing to do with our superintendent, but it was just hard to get because it had to go through everybody upstairs in student services, including me. And then it had to go down to our finance, procurement of contracts. And through there, it has to go through our lawyers and it has to go through somebody else that I don't even know. And then it finally goes to our superintendent. So it has been a process. And like with Hazel Health, our telehealth provider through the consortium, it's still a huge process just because they have to go through a lot of IT stuff. Accessing schools, because MOUs were so hard to put in place, has been difficult this year. Getting into the schools for our service providers has been quite difficult. And I think that Eric's team with Prosper was the first ones to actually be able to get into the schools this year, just because they're going into lunches and things like that, but other providers were trying to do other things. So it's been hard to get into the schools this year. Coordination across providers has actually been going quite well, I think. I do a spring and fall like mental health fair, and I invite all of our providers in the community, including like I really try to get our consortium providers there. So our community does know what is available within the school system. Eric and his team have been at every single one of my events, but I also tell them like, hey, you should network with everybody here. I tell our school social workers like, because they usually have a table at one of the events. I'm like, go find out what is in the community because some of them don't even know like everything that there is to offer. And then measuring success within the consortium has also been a little bit of a struggle. Working with the partners and getting all of the data that the consortium wanted, the school system did not know what data they were collecting until just recently, especially for last year's consortium. So my director was told about the data process and then it came to me. So I had to reach out to all the partners, which some of them are not partners this year. So that was fun to do. But measuring success though, once I got the data, it was actually great to be able to see like the success that was being made within the school system and with the providers from the consortium. I, got a lot of good data from all of our partners of like, wow, like it is making a good difference. Now, this next school year, we are told that our local behavioral health authority is going to be our hub, which we have never had a hub yet. So we are very excited about that. And that is where the data will all be housed. So I work closely with them anyways, especially with the child and adolescent subcommittee that they have. So I think that it will hopefully be a much smoother process next school year with our consortium partners and measuring all of the data that we need.
And on the, I agree with you on that. The access to schools was definitely one of the, and still for many providers, one of the hardest parts. We were somewhat unique because all we really needed was access to lunches and to speak in front of wellness classes and teach, teens about self-care. But even that was hard at times. Like, this is not just unique to Calvert. We saw the same thing in the other counties that we were in. And sometimes it was, it always starts with building those relationships. They have to trust you. Like even if there's an MOU in place, which there was, and we have a mandate from the state, great. But it's still building relationships, building trust, and assuring them that we're not going to mess up your day and take, hours of your time. Like make this as painless as possible for the staff so they can go about doing their work and we can just go in and amplify the good stuff they're already doing, as opposed to kind of distracting from everything else. I think it was the hard. I mean, honestly, one of the biggest schools in the state. We couldn't get into, and I ended up just showing up after the school day ended when the buses were pulling out, and the principal was standing out in front of the school with his walkie, and I just introduced myself, and that was all it took. But it was so hard, just trying to reach by email and calling. Just it's just it's a school staff, as my wife always reminds me, are incredibly busy people. So um, just some of the feedback, and I think that we've heard from Tiffany and from Emily in Prince George's County and others is, make sure not only collecting data, but get some of the you know, qualified insights as well. Data is great, but also what are we hearing from school staff and teens, and parents? And so we're as I know the other providers are doing, trying to collect that because we want to be able to learn from it as we expand and go into more counties and work with more rural communities as well. What are those lessons learned that we can take on? And I'm not going to read through these word for word, but in working with the school staff last year, we got a lot of good feedback. But also, some of the feedback was, hey, we got to do better on A, B, and C. And that's fine, right? Feedback is good, and you just got to process it and make sure that you can integrate it. And in the case here, just helping students with their social emotional learning has been important. And I think as we're talking about the counselor, counselors using it, and when teens can share with their counselor how they've been doing, not just saying, I think I was okay last week, but actually look at that private, but digital record of how they were doing, it can help identify students that would benefit from, pathways or these other resources in a community. So I think that, you know, all the tier partners are working together, and we're all trying to collect information, collect feedback, and obviously do it so that respects privacy. But at the same time, we have to understand what's working and what's not, so we can continue to positively impact more teens. I just have a couple slides that we'll hit on the data, and now, like I said, Prosper as an app, we took a position to basically not retain any PII information for the most part. So everything is de-identified and aggregated, but we do provide data to the school systems, to the Behavioral Health Authority, to the National Center for School Mental Health, and to the state of Maryland's consortium program, just around aggregate trends, demographics, which a lot of these are more around demographics. But understanding what percents, and it's probably hard for folks on the call to see, but typically 9 or 10% of teenagers, which are the red and green pies in a pie chart, aren't feeling well. And some of it could be physical. They could be athletes or whatever. They don't feel well for that aspect, but they may also feel bad because they're dealing with bullying. They're dealing with things that are going on inside their home. And so those are the areas where, from a prevention self-care perspective, we promote them to other resources. We're obviously 988, but also other things to help them get that support they may need in the community, and even tools within the app. Is there anything on here, Tiffany? I can go to the next slide on this slide. Anything you want to jump on with the data, maybe more generally on the data?
Yeah, I mean, I think that whenever we were looking at the data, myself, my supervisor, and things like that, like it really did jump out to us. And I mean, we knew this in our heads, but like just how much sleep can like really affect a teenager's mood. I mean, really affected adults' mood too. Like it definitely affects me as well. But like just looking at it and seeing like, oh, well, they're not getting adequate sleep because of, I mean, maybe in our mind, we know why, like something's going on at home and things like that. Like the counselors usually know that thing, but they're not getting adequate sleep and then they're acting out in school, or, they're feeling depressed, angry, XYZ. So whenever we were looking at the data, we were like, yeah, like we know this, but looking at it and it being in front of us was just like, wow.
Yeah, we're definitely seeing this, don't want to say it's causal, but a correlation between sleep and mood, and then ultimately then, performance in school. And I think anyone that's, we've all gone through school, and sleep is an issue for me, and that was a long time ago. But I think it's social media and the use of technology probably has made it worse. One would think. But just we're looking at the pink chart here is top 10 emotions when users, in this case teens, are saying they're feeling awful or bad. in their daily check-in, they can indicate what that looks like and for them, and you'll see the top three are stressed, annoyed, sad, right? Not too surprising, but then you start wondering what's behind that, and then you can describe those things that relate to how they're feeling, and what the first thing that the most common response about why they felt annoyed or stressed or sad was school. But when you dig under that, because they spent a large part of their life in school, the middle chart here shows when they said they felt awful or bad, and school was part of the reason why, because you actually can pick multiple reasons why you feel the way you feel. And you strip out school, then you see, I'm just looking at the little bigger version, friends and then sleep, right? So the impact of peer networks, social media, bullying, I know it's a big focus for Calvert County and other counties. But then sleep being the second one. Self is the third one. That's reflecting on themselves and how they feel. But yeah, sleep and the impact of peer networks, and I think exacerbated by social media, is an area that, if anything, this information can help school systems just think about where they want to put programming. And then the last one was, we do have a survey that the National Center for School Mental Health approved, that pops up for teens in the counties that we're in. And the first question was, how would you rate your overall mental health? And so, but we have all other questions about, where do they go to for support? There's a big difference between male and female responses. Females go more to their peers, whereas male responses were, and it's not somewhat different. It's incredibly different when you look at the bar charts. The young men are going to adults, whereas the young women are more likely to go to their girlfriends, I guess. And my wife says she sees that all the time with teens. And how does that change the school system's approach, and how you think about that? I don't know, Tiffany, if you have any thoughts on different ways of leveraging this type of insights.
Yeah, I mean, I feel like, as a woman who has been a teen girl themselves at one point and whatnot, like, I saw that in school a lot too, where, I would lean on more so my girlfriends and things like that, and like talk to them about other friends that, maybe were making me have a bad day. And I think that that's where that kind of comes in, where like the girls usually like are very cliquey in high school, especially. Like they have, their tight little group of friends and whatnot who they think that they can, really actually bounce off ideas. Whereas, the males, I think that most of them find their friends within like sports and things like that. But if they're not in sports, then who can they necessarily rely on? And I think that that's why they're mostly going like to the adults and whatnot. But um, a lot of our male population, like I feel like they also keep a lot of that in, like, which is a big stigma and has always been of like, oh, you can't cry because you're a male and whatnot. So I think they keep a lot of their emotions in. So it's great to see that there's a way that they can get it out, even if they're not necessarily talking to somebody.
Yeah. No, and it's true, Tiffany. We're still seeing about 60-40 split between, for the thousands of people teens using Prosper in Maryland, still 60-40 split between female and male, woman and man, but it's not 80-20, which is good, right? So the fact that we're still seeing, well over 1,000 or 1,500 of the users being men, which is good to see. It gives them one outlet. Our team is actually focusing on making sure we have, some of the personalization and fun stuff in the app is not just geared towards women. Even the majority of our team are young women. It's just, how do you make it an experience that resonates with both genders?
Mhm.
So. The last thing is, we did a research study, and then a lot of the other providers also had different studies going on. We worked with Bowie State University and had two researchers collecting the different data. Again, it's all de-identified and aggregated, but basically trying to connect the dots between the surveys, the inputs that were in the app, and other questionnaires that we had. And I think the main thing on here, and I'm just keeping track of time, is that they saw that increased mental wellness, um, and some of this is intuitive, right? Improves academic performance, but increasing the increased emotional awareness increases engagement. I think that was, that's something we intuitively know as well, but it's good to see how that comes together. We can also look at it across different segments as well. And then, interestingly, family support, uh, we saw increased family support, increased their overall social emotional learning, the self-awareness, self-management. So, and that's not easy. Some kids are not coming from, a two-parent household or even one. Sometimes they're living with grandparents or just in other situations. So some of the stuff is not easy to solve for, but I think just being aware of it, tracking it, and trying to have solutions that can help all these different cohorts will be important. And the last note on here, and I think we just have about 5 minutes left. Um, is we're working with Tiffany's group and the same similar team at Prince George's County in the state to add additional questions, again, where the answers are de-identified, but questions that can really start helping understand the impact of Prosper and similar tools around absenteeism, bullying. I know it's a growing concern. So there's more work to do. I think the lesson for us is working in the rural community was building the relationships, working with the other partners. Nobody can do it alone, especially in rural communities. Everyone has to kind of pull together. But we're far from done. There's a lot more work to do. So to that, and anything, Tiffany, that I know we only have about 5 minutes left that you wanted to hit on?
No, I mean, you did say this earlier, but like in our school system, actually starting last year was the first year that like cell phones were not allowed to be used in the schools, which like I agree with, they're there to learn and things like that. However, I do think that there are um, reasons that cell phones should be also permitted, but some of the student, some of the schools actually like take the phone away and things like that, depending on where they're at. But they do have times where during the school day that they are allowed to use them. And I mean, some of the students still sneak it, obviously, but that has been one of the like growing pains with the technology piece of whether it be Prosper or Hazel Health, for example, where it's just hard for the students to access certain things, especially during the school day, where it could be a helpful thing for them to be able to access.
Great, agree. I know I know it was a smaller audience today because we were late to getting it. I was late to helping you get this promoted out. But was there any questions from anyone on the call?
I'll open it up and see if anyone has any questions before we wrap up.
Chrissy?
Yeah, Eric, I was wondering, how do private schools bring Prosper? What's the method or mode of doing that?
Yeah, I mean that's a fair point. Right? We're working with the public schools through the consortium grant. I was just having lunch, Chrissy, with a friend of mine who's runs a network of clinics, and she asked the same thing because their clinic does a lot of similar work in private schools. And I know there are a number of private schools in Calvert County. It's open to any teen or adult, frankly, over 13 in the U.S. to access and use Prosper, but it's just more of creating awareness in us actually talking to those schools. So if you're aware of schools that you think would benefit from at least that conversation, let us know. But it has come up more certainly in the last, especially once we start sharing the numbers that we had from the spring. I think we crossed 50,000 check-ins in Prosper just last week, just since the spring, with teenagers. So if you're aware, Chrissy, of any additional schools and private schools as well, we're not exclusive to just public schools. It's just where our focus is and that's where the majority of students are. But let us know.
Great, thank you.
Sure. All right. I know we just 2 minutes left. Any other thoughts? Seeing as Janice is on, or if not, we can end. But appreciate Yvette, you and Jonathan permitting Tiffany and I to reschedule this to today. I'm glad you're able to record it so we can share it with our networks. And Tiffany, thank you for your always great insights as well.
Thank you.
All
Yes,
right.
absolutely. Thank you to both Eric and Tiffany for presenting and providing this important information. We appreciate it.
Great. Thank you.
Thanks so much, everyone.
Bye.